Hello and welcome to Heads Up, a year-long mental health awareness journey. Dartmouth Health's webinar series, which focuses on the important mental health topics that are affecting all of us. I'm Audra Burns, the Senior Media Relations Manager at Dartmouth Health and your moderator for this series. So today we're going to discuss the unique mental health challenges in the workplace and what resources exist and are still needed to help support struggling workers. So I have three great panelists joining me today. And first, we have Dr. Luke Archibald. He is an addiction psychiatrist and the Director of Addiction Services at Dartmouth Hitchcock Medical Center. Good morning, Luke.
Good morning. Hi, thanks for having me.
Next, we have Dr. Stephen Cole. He is the lead psychologist and manager of Dartmouth Health's Employee Assistance Program. Hi, Steve.
Hello, thanks for having me.
Great to have you here. And rounding out our crew is Rusty Fowler, who is the Global Benefits Leader at Hypertherm. Hi, Rusty.
Good morning, Audra. Thanks for having me.
It's so great to have all three of you joining me today because we're going to talk about, really changing the conversation around mental health and hopefully to end the stigma around it. And you all are uniquely positioned to help with this topic around workplace because workplace has traditionally been a place where people may have felt uncomfortable or unable to freely discuss their mental health challenges or struggles for fear that they might negatively impact their employment or opportunities for advancement. So some companies, however, have taken significant strides in protecting employees and providing them with help. And I'm very pleased to be working for Dartmouth Health because we have taken so much strides. But there really is a lot more work left to do. And I think that we can help out with this discussion today. So Luke, let's lead with you and let's talk about what signs employers, managers, supervisors, or colleagues, what should they be looking out for if they suspect a coworker may be struggling with their mental health?
Well, first, mental health diagnoses and substance use disorders are very common. About 1 in 4 Americans either has one of these conditions. About 1 in 4 Americans has one of these conditions at any given time. So the reality is that just about everybody either has a diagnosis or knows somebody who does. Employers would want to be on the lookout for sort of unexplained changes or declines in performance. Depression, one of the more common diagnoses, is characterized by low mood, changes in sleep, concentration, energy, and substance use disorders can have some overlap as well, with changes in mood, changes in appearance, judgment, concentration. But nobody's asking an employer or a colleague to diagnose a condition. Ideally, there's a supportive environment where people will feel open to tell others if they're struggling. But the general idea is to kind of look out for any sort of unexplained change in behavior or performance.
I mean, that's such a powerful thing where you said 1 in 4. I mean, that's a huge reality check that I think that we all can help participate in ending the stigma. And those are some really great things to look out for. So thank you for that. Steve, let's talk about how the pandemic has really impacted employees' mental health. Generally, have you seen an increase or decrease in outreach for services? And what issues are you seeing most often?
Yes, first, I would agree with Dr. Archibald that it's helpful for employers to notice changes in employees' behavior, such as calling out more frequently, and making a point to check in with their employees more often. In addition to absenteeism, there's also presenteeism, which is sort of showing up for work, but not really being there, not being very productive, sort of being checked out, wrestling with feelings of burnout, perhaps. The pandemic's really increased our utilization for our employee assistance program, and that increase continues 2.5 years in. We've seen a marked increase in employees with symptoms of anxiety, problems with sleep, increases in depression, post-traumatic stress disorder, family problems, and substance misuse. Over 47 million Americans quit their jobs in 2021, and that over half of them cited mental health problems as the reason.
Wow, that's that's an interesting look into, how big this has really impacted us. And I liked how you mentioned presenteeism, because that is a different spin that we might not necessarily think of. And that kind of speaks to what Luke had mentioned about, even if they are showing up, are they not, being prepared, or have their, has their hygiene went down? And so thinking of whether they're at work or not at work, has there been changes in how they are? So thank you so much for that insight. So Rusty, now let me turn to you. So first, let me pose that same question to you, because Hypertherm is a very different kind of company from Dartmouth Health. So what are the issues that you are seeing most often, and how has the pandemic impacted those?
We are seeing a lot of the same issues that have already been mentioned, with an increase in anxiety and depression and substance use disorder that are resulting in more applications for disability and leaves of absence at Hypertherm. And at our company, we really try to coach our leadership to be aware, as was mentioned earlier, about changes in behavior, whether it's a different body language or facial expressions or reactions to stress in a work environment. And we really try to work hard to create as positive and open environment as possible, so that our associates feel comfortable reaching out and asking for help, and know where to go to get those resources, so that they can get the proper treatment that is needed.
I know that you and your group over there at Hypertherm are doing some really great work around this, so we certainly appreciate it. Now, Rusty, are there laws and rules in place to protect employees who express to their employers that they might be experiencing mental health challenges? And what about confidentiality?
Yes, most definitely. There are absolute HIPAA laws and ADA, Americans with Disabilities Act regulations that keep employers from prying into this information. Again, we try to create an environment where our leadership group is trying to notice small things as they get to know their own associates, and changes in behavior, and recommend the different resources that people can go to. Sorry, lost my train of thought here. Apologize. So we do send people to third-party resources, so that people can apply for disability or leave of absence on a confidential basis. And then the information we get back does not include any kind of private information if the associate is not interested in sharing that.
Well, I know you have a lot of great resources that we certainly can't touch upon in this long of a program that we have. But we do, for our viewers who are watching, we will be linking to resources that are available that our panelists suggest for you to check out. And those will be linked at the bottom of this video. So now, Luke, let's turn to you. For example, if I'm an employee who's struggling with depression, anxiety, or substance use disorder, what resources are available to me, and what are some strategies to help people strike a healthy, that work-life balance?
Sure. Well, I would first just note that substance use, as well as mood and anxiety, it can fall on a spectrum from sort of a relatively healthier, safer use to a more problematic diagnosable condition. So anybody can benefit from proper sleep, nutrition, exercise, meaningful social connections, or activities outside of work that are important to them. Those are all helpful for mental health. But when things get to a point where their life and activities are really impacted by a diagnosable condition, that's where more formal treatment really is necessary. If somebody has a primary care provider, they can ask that provider or talk with the provider about what's going on, and it's likely that they'll be able to start treatment or provide a referral. In the state of New Hampshire, there's the New Hampshire doorway system, so anyone can call 211 at any time to access treatment for substance use disorders. Vermont has a different setup, but people can still call 211 to get resources for treatment of substance use disorders. And everybody should be aware of 988, which is the National Mental Health Crisis Line. for anybody that is feeling suicidal or having another kind of mental health crisis. They can call that number at any time.
Thank you for those resources, and we'll be sure to link them in the video because there are some really great resources out there. So Steve, let's turn to you about, employee assistance programs. People may have heard of them. They might not even know what they offer. They might not even know they have access to them. So let's talk about employee assistance programs and how they support employees who may be dealing with mental health concerns or substance use.
Sure. Well, employee assistance programs, or EAPs, generally offer mental health services, and concerns that employees may have are really on a continuum. Some employees may just need a place to talk, and other issues can be quite serious. Dartmouth Health employees can self-refer to our program for short-term therapy and consultations. Our services are confidential and free for employees. More generally, EAP programs could be internal within an organization or external, or some hybrid, which is what we have at Dartmouth Health. The employee's contact with our licensed clinicians starts with a thorough assessment. We offer cognitive behavioral therapy, general problem-solving support. We can refer to a primary care physician or psychiatrist when we feel medication may be helpful, or to a higher level of care, such as an addiction treatment program, such as Dr. Archibald's. We help employees generally break feelings of being overwhelmed down into more manageable pieces, and work on problem-solving skills and providing support as they do that. In addition to EAP services, many employers like Dartmouth Health offer a wide range of wellness services, wellness activities and services such as health coaching, and things like stress management classes.
I know I've already taken advantage of our stress management classes. Those have been wonderful. And I think what's great that you mentioned is that you have a hybrid approach. And I think that's important for people to know and to check with their own employee assistance program, that it doesn't necessarily mean you have to go and speak to someone face-to-face in person. It could be remote, or it could be some educational classes or learning opportunities, or just online resources. So I hope that our viewers will reach out to their EAPs and see what they do have to offer, because I know that Dartmouth Health has a great program. So now, Rusty, let's turn to you at Hypertherms. How does your EAP program work? And can other employees, particularly small business, who likely might not have resources such as EAPs, because there are small businesses out there, or possibly even HR departments, how can they support employees' mental health and well-being?
So at Hypertherm, our associate assistance program allows for free phone support. And if that support progresses to another level, they can schedule up to 10 free visits with a mental health counselor in their local area. And in addition to that, we do offer a number of other well-being type of resources, whether they're phone applications or web applications that support our associates with mindfulness, stress management, nutrition management, financial education. And another option that we use is through our medical plan. Our medical plan has telemedicine, chat technology services that is available 24/7. So people can access resources at their own time and their own convenience. Otherwise, other resources we try to rely on are those that are available in the local community. And we do refer our associates out, for example, for outpatient substance use treatment, local organizations that help support these things, with the expertise that they're able to bring to these very challenging areas.
That's really great information. Thank you for that. And we will link to some of those community resources in the bottom of this video. So now, before we wrap up, I'd love to touch base on what's one key thing that you want our viewers to take away from this conversation. And Luke, I'll start with you.
I would say that problems with mental health and substance use are very common, that treatment's available and it's effective.
It's a perfect way to wrap that up. Steve, let me turn to you.
I'd encourage people to remember that almost everyone has struggled at some point during the past 2.5 years of the pandemic, and employers really need to try to remain connected to their employees, get to know them, what their lives are like outside of work where possible, encourage input from employees and allow them some control in their work environment. And finally, I would say any investment in access to mental health services is a wise one.
Definitely a great investment for sure. Rusty, let's turn to you.
I would encourage people to reach out to their employers, and don't be afraid to talk to them, and be open and honest as you can about the challenges that you're experiencing, and know that you're not alone. And many companies have resources in place that can help, and your confidentiality will absolutely be protected, and resources will be provided to help you in any way possible.
That's a great way to wrap up this segment. Never struggle alone, and have that conversation, because as was mentioned in the very beginning by Dr. Archibald, 1 in 4 are experiencing a mental health challenge. So we can all do our part to truly help out ourselves and others. The resources are available. So this has been a really great conversation. I know we could go much longer, but you have offered some great advice and some great information for both employees and employers. So thank you to Dr. Archibald and Dr. Cole and Rusty for joining me today. I really appreciate it.
Thank you.
Thank you.
So to view past Heads Up segments, you can see them at the link at the bottom of the screen. Stay healthy and stay safe. Take care.